Okay, started your timer and here is your question. Right, so if you have read and understood, considering it communication skills teaching, kindly begin.
Yeah, good day. I'm Dr. Kamaldin Ibrahim. I want the candidate for the exam. May I check your name and your date of birth, please?
Hi, my name is Joe. I am 45 years old.
All right, Joe. It's nice meeting you today.
Yeah, nice to meet you, doctor.
All right. I'm aware you've done barium swallow that shows that you have a narrowing in your lower esophagus, and that is why you are here today for what we call OGD. Can you tell me what you know about OGD, please?
Well, I don't know. Actually, my GP sent me to get it done.
All right. Okay. So I'm here today to tell you everything you need to know about OGD.
Okay.
Is that okay by you? Can we go ahead?
Sorry?
I said, is that okay by you? Can we go ahead? Can I go ahead?
Yeah, of course.
All right, Joe. So OGD simply means what we call esophageal gastroduodenoscopy. It involves the use of a tube, small like tube that has a camera at the tip. This will pass through your mouth down to your food pipe, so we can see everything from the upper part of the food pipe down to your lower part of the food pipe. Then also your belly, so also see your belly, and also then the upper parts of your small intestine. So this will allow, in case you see anything, see if there's anything there, and if there's anything, then will also allow us to take a sample, a tissue sample, which will send to laboratory for test for investigations. Do you understand that?
Yeah.
Joe?
Okay.
Okay. So now tell you about the alternative. The alternative to this particular test is the one you have done, which is the barium swallow. However, the advantage of this over that is that doing this, you can see, and whatever we see, we can take a small sample, a cut from it to test, to send for test, which what you did initially could not afford us to do. But that only shows that you have a narrowing in the lower parts of your food pipe. Do you understand that?
Yes. So, doctor, the test, will it be really painful for me?
Okay, Joe, I can understand your apprehension. All right, but for the test, we'll give you some, we'll call it a spray to numb your mouth, and also the main part of your food, the beginning of the part of your food, your food pipe. And also, we'll also give you some injections to calm you down, call it anxiolytics, and also something to also relax your food pipe. So while we're doing it, we'll have given you this, and you won't have any pain whatsoever. Do you understand that?
Yeah, that's really brilliant. And is there any risks from this procedure, doctor?
Yes, Joe, there's no procedure without a risk. So there are risks that could follow this procedure. And one of them is you could be injury to your teeth. in the course of the course of the procedure. There could be injury. There could be what we call infection because of the. You could have infection at the end of the procedure, and of course, more importantly, or the most dangerous part of the risk is there could be injury to the part of your food pipe, and this could actually perforate your food pipe, and could actually be very, very dangerous. However, it's something that occurs rarely less than 1% of the population. And not to worry, this procedure will be done by the experts, and is what we do regularly, and you can be sure that you will definitely be fine. Are you okay with that, Joe?
Yeah. Actually, that perforation sounds terrible. I'm sure that there will be like skilled doctors.
You said what? Pardon?
Are you sure that I will be in safe hands?
Yes, you will definitely be in safe hands. It will be handled by by an expert. You understand? One of our senior colleague and people that handles it. So you are definitely in safe hands, Joe.
Okay, all right. But one thing is, Doctor, I have been salivating a lot constantly. I have to use tissue every time.
Sorry, come again?
I have been salivating. I don't know why. Please explain to me.
Oh, okay, Joe. I said earlier that the initial test you have done, which is the various swallow, shows that you have a narrowing in the lower parts of your food pipe. So this is why some of the saliva that we produce above this area will not go down. So that is what is trying to probably come out. Do you understand that?
Yeah, that makes sense now.
Because of this procedure, whatever that is there, we can always take a sample and could tell you whatever it is at the end of the day.
Yeah. All right, Doctor. Is it cancer? Because you said narrowing and like it sounds like a growth. So is it cancer?
That is difficult to say now, Joe. But at the end of the procedure, whatever, if there's anything, we'll take sample. Usually within like 2 weeks, the results should be out. So at the end of the results is when we can tell you if it is or not. But at the moment, it's to be too early to say.
Okay. Right. So when will the results be back? Yeah. So it's 2 weeks, right? Do I have to stay in the hospital after this one?
Yes, 2 weeks. Okay, Joe. Not really. You don't have to stay in the hospital. However, you need to. You come in the morning of the procedure, but you don't take any foods after maybe like 12 midnight before that day. However, you can take water or any liquid diets within 2 hours of the procedure. Yes, and also when you're coming, you need to also try and come with someone that probably accompany you home.
Oh, okay. Right. And is there any do's and don'ts after the procedure?
After the procedure, well, initially I mentioned that we'll just have a spray into your food pipe so that you don't have pain. Another alternative is to probably put you to sleep or give you some medication that probably
No, doctor. I mean, after the procedure, is there any other do's and don'ts for me at home?
Do not drink hot drinks.
After the procedure,
give that advice.
After hello?
Yes, please.
After the procedure, you can go home. You might need to take little while before you could take something. Now, whether you're going to take, you can start with a warm water, and gradually you can increase your food. And of course, we'll give you some pain relief in case you have any pain.
Okay. All right. So,
yeah,
all right. So I've got the test. The blood test. I think is there something wrong with that? my liver test?
Okay, I've not seen that. So I'll have to check that and get back to you. We'll tell you about that. So for now, I've not seen the results.
Yeah. What should I do if my liver function is not
Is that
good?
okay?
What will you do for me?
If what?
If my blood test for liver function is not
Hello?
good, what would you do for me?
Yeah, if the blood test for liver is not good, I need to give you some medications before that is carried out. If it's low, we might need to give you some what we call it now? We might need to give you some drugs.
Can you
Hello?
just summarize? Yes, last few words, ending words. Please.
Okay, Joe, I've discussed with Joe, 45-year-old man who came with a result of barium swallow that shows a narrowing of the lower esophagus. Patient has been counseled on gastroduodenoscopy, both the education for the procedure, the complications, the advantages of the procedure has been highlighted to the patient. And
You're
also
talking all this you're telling to the patient. You're summarizing that what we have discussed so far, all this, and then what should be your concluding sentence?
okay, okay, so we are here to support you and
Yes.
to give you helping hands. So whenever you need help, we'll be here to assist. Thank you so much for your time.
Yes, and if you agree with everything that I've told you, then you have to sign this consent form for OGD.
Okay.
Yes,
Okay.
this should be, yes, your concluding sentence. Good, thank you.
Madam,
Yes,
last time,
yes, yes.
last time you told that patient will summarize that he has mental capacity, or this scenario is not related to.
It was not for this scenario.
They're not this one.
It was not this scenario.
It-
In
it
this
was-
one, it was
Thank
Dama. That was
Dama.
Dama's splenic injury. You're confusing. In this scenario, this is OGD, and concluding sentences should be that doctor, after all this question and answer has been taken place between the patient and the candidate, last sentence would be the candidate will summarize to the patient and will say, okay, if you agree to all this that we have discussed, blah, 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 all the rest, whatever doctor was telling, then you have to sign this consent form. And then you can also say that we are here to help you. If you come across any question, I'll leave my number with the nurse. You can always contact me. So like this,
So it means summarization depend on the scenario, either patient condition.
Right.
If it is, he has a
Thank
head
you so
injury
much.
or trauma case, or
Yes.
he is very old, then I will check his mental capacity.
then you'll check the
Body.
capacity of the patient, but not in this one. In OGD, patient
Yes.
has the capacity. All
Yes.
because if there is a trauma case, then you can think that patient is drowsy or not present. So you have to confirm the capacity, or patient has recently been operated. But in this one, patient has not been operated. There is nothing which is causing patient drowsy or unconscious or confused. So you don't have to confirm the capacity. Patient already understands the situation and everything which is going on. So you have answered all the questions of the patient, and at the end, you'll make sure you're summarizing as a candidate, and then you are making sure that patient signs the consent form. Like you will say, okay, if you agree, then sign the consent form, and patient will sign it.
Just
And then you
thank I
can say,
understand.
okay, I'll leave my number with the nurse in case you come across any question and you want to
Yeah.
Yes, that's correct.
more explain. Yeah, good. Here, everything was good. I must say, it was nicely explained in the beginning, but last two questions, maybe you could not understand the language or something, because you were telling again that what are the ways you'll perform the procedure. Instead, if you would have explained that what are the things to do if you will do the under general anesthesia, and what are the procedure, what are the what are the measures patient can take, because patient did ask what are the do's and don'ts I should do around this procedure. So you could have like told, yeah, but then you did tell afterwards. So just that. Otherwise, it was good, very nice and composed and comprehensive.
Thank you, ma'am.
Thank you.
Thank you so much.